I'm Ella Toon, and this is an investigation of etiology and associated prevention strategies. Intrinsic risk factors originate within the athlete's body. Examples of these are age, so the younger, the more likely softer bones are to break. Fitness, growth, weightlifting can put pressure on growth plates. Gender, males have testosterone, which means quicker muscle repair. And injury history, may be more susceptible to a specific injury. Also, lack of flexibility. This means that performers' muscles will be tight and muscles may thicken, which will decrease in the range of movement. Inadequate fitness levels, so athletes need to be fit enough to complete the skill level required in their sport and to do it over a sustained period of time. Psychological factors, this can be performers' attitude towards performance. Poor preparation, so athletes need to be able to prepare properly for an event. And postural defects, so scoliosis, which is abnormal curve in the spine, and lordosis, which is an excessive inward curve in the spine. Extrinsic risk factors originate outside the athlete's body, meaning they have an increased or decreased chance of getting injured. For example, misheard or poor instructions, so in training a coach needs to be able to communicate by giving clear instructions. Incorrect technique, an athlete who moves more efficiently is at less risk of an injury. For example, if a weightlifter is lifting heavy weights and their technique is poor, then the movement is being repeated wrong and it can constantly strain specific areas. Clothing and footwear. Many sports require specific equipment. For example, footballers should always wear shin pads to remove any potential hazards. Surrounding sports players. Many sports performers may not have any issues with surrounding players, but in some sports, the rule of contact makes some athletes a lot more susceptible to injury. For example, in football, mistimed tackles or challenges. Environmental factors, for example, the weather, as it can have an impact on the surface. Misuse of equipment. Equipment should always be used appropriately as it can cause an injury. And inadequate nutrition and hydration. If an athlete has too little energy to do an appropriate, if an athlete has too little energy due to an inappropriate match meal, they'll become fatigued more quickly. Prevention measures. Principles of injury prevention model. The first thing that should be done is to try and establish the extent of the problem. This can be done by finding out the patient's injury history, severity and timing of injury. The second stage is to establish the etiology of the injury. For example, whether the injury was caused by an intrinsic or extrinsic factor. And lastly, the third stage is to implement a preventative measure to try and aim to reduce occurrence of injury and review and evaluate the preventative measure that was put into place. The role of the coach needs to help prevent injury as much as possible. They need the skill and knowledge to manage intensity and load. Equipment and environment. A risk assessment should always be carried out before performing. This will help oversee any issues surrounding the environment. It is vital that an athlete wears the correct training gear depending on what sport they are doing to protect themselves. Appropriate training. An athlete should appropriately be trained to meet the demands of their sport and also recover in the correct way, which means sticking to a training routine. And the correction of biomechanics abnormalities. An athlete should undergo professional screening depending on the level of performance to try and find any abnormalities at an early stage. Gait analysis is an abnormal gait is usually a high risk factor or can be caused as a result of an injury. By observing someone who may suffer may help them identify possible causes of non-contact injuries and allow us to see how well the body moves as a whole. The easiest way to perform an observation of gait is to observe an athlete from the front, side and back while looking at the key phases of walking and running. The walking gait is made up of a stance phase and swing phase. The stance phase starts and ends when both feet are in direct contact with the floor and the weight has been transferred from one leg to another. This part is known as the double support phase. The stance phase begins with the initial contact with the floor and progresses through to mid-stance, where the foot goes from contacting the floor to the heel rising off the ground, ending up with a propulsion of the big toe into the swing phase. and the running gait. The mechanics of the running gait are similar to the walking gait as they both share a stance and swing phase. However, in the gait cycle of running there is no double support phase. Running has a flight phase. This is where neither foot is touching the ground. As the speed increases, so does the flight phase and the force is through the body. The factors to consider when looking at both gaits are the duration, the position, motion, footwear and change in speed. Gait abnormalities: pronation, meaning overpronation is when the foot rolls excessively inwards, and underpronation is when the foot rolls outwards. And pelvic tilt, the orientation of the pelvis. Excessive pronation and supination can lead to injury. Athletes with high arches usually have supination. Athletes who may have a flat foot or collapsed foot usually overpronate, and you may also see a lateral pelvis tilt. You should give the athlete advice or send them to a podiatrist if they have gait problems so that they can get advice on specialist footwear and resolve the abnormality. Structural abnormalities. Forefoot varus. This is the angling or inverted position of the bones in the front of the foot in comparison to the heel. This causes the bones on the inside edge of the foot to sit higher off the ground than the outside of the foot during weight-bearing exercise. Foot valgus is where the forefoot is everted in comparison to the rear foot. Bow legs, when the lower leg is more outward than the upper limb. This can be caused by an abnormal bone development and fractures which may not have healed correctly. And knock knees is a condition where the legs curve inwards, causing the feet to be apart, and it can be caused due to injury of the shin bone, obesity or bone infection. Associated lower leg injuries, for example, stress fractures, a small crack in the bone caused by repetitive stress. Blisters, small bubbles of fluid which are caused due to friction or heat to the upper layer of the skin. Bruising through things such as impact or repetition of stress. And plantar fasciitis causes heel pain. Preventative measures of these are primary prevention, which is preventing injuries occurring in sport, and secondary prevention is working with an injured athlete and focusing on how to reduce further injury. Thanks.